If you are over 70 years old, or if someone you love has reached this age, what I am about to reveal could save a life today. There are 5 extremely common medications that doctors prescribe every single day, but that become silent threats after 70 years. These substances accumulate in your body in dangerous ways, causing falls, fractures, and mental confusion that many mistake for dementia. After 70 years of age, your body goes through dramatic changes that most people, and even some doctors, do not fully understand or consider. Your kidneys and liver, the organs responsible for filtering and eliminating medications, start working at only half their original capacity, or even less. This means that a pill that used to leave your system in hours now stays inside your body for days, accumulating to dangerous levels silently. The result is a cascade of problems including severe dizziness, dangerous falls, broken bones, memory loss, and confusion that destroys independence. What are these 5 medications that become so dangerous after 70, and why do they stay in your body for so much longer than before? How can you tell if confusion or memory problems are actually caused by medication buildup, rather than true dementia or natural aging decline? Stay with me because I will answer every single one of these questions, and what you learn today could prevent a tragedy in your family. Before we continue, please leave a comment telling me where in the world you're watching this video from. I love hearing from you all. Think of your kidneys and liver as filters in your home, working perfectly for decades to keep everything clean and running smoothly every day. But after 70 years of constant work, these filters naturally slow down, just like an old coffee maker that takes longer to brew each morning. When medications enter your body, they need these organs to break them down and remove them. But now this process takes much longer. Research from major universities shows that drug elimination can slow down by 50% or more in people over 70 compared to younger adults. This means that a sleeping pill that should wear off in 8 hours might still be affecting your brain and balance for 16 hours. The medication keeps building up with each dose, reaching levels in your blood that were never intended by the doctor who prescribed it. And now, pay very close attention, because I am going to reveal the 5 medications that almost everyone takes, but that become extremely dangerous. These are substances that your doctor might have prescribed years ago, but that need to be reconsidered immediately after reaching 70 years of age. Medication number 1. Benzodiazepines for anxiety and sleep, including diazepam, alprazolam, clonazepam, and lorazepam, commonly known by various brand names worldwide. These medications are prescribed millions of times every year for anxiety, panic attacks, and insomnia, and they work by slowing down your brain activity. In younger people, these drugs leave the body relatively quickly, but after 70, they can stay active in your system for days instead of hours. Studies from respected medical institutions show that older adults taking benzodiazepines have triple the risk of dangerous falls compared to those not taking them. The medication accumulates in your brain tissue, causing constant drowsiness, confusion, memory problems, and severe balance issues that lead to broken hips and bones. What makes this even more dangerous is that many people have been taking these pills for years and do not realize the cumulative effect happening. Your body builds up higher and higher levels of the drug because your kidneys cannot clear it out fast enough between doses anymore. Doctors often mistake the resulting confusion and memory loss for dementia or Alzheimer's disease, when it is actually reversible medication side effects instead. International research has proven that stopping these medications under proper medical supervision can restore mental clarity in many cases within weeks or months. The tragedy is that many families watch their loved ones decline mentally, never knowing that the sleeping pill or anxiety medication is the cause. These drugs also increase the risk of car accidents if you still drive, because they slow your reaction time dramatically, even the morning after. If you have been taking benzodiazepines for more than a few weeks, never stop suddenly, as this can cause dangerous withdrawal symptoms including seizures. You must work with your doctor to taper off slowly and safely, reducing the dose gradually over weeks or even months, depending on how long. There are much safer alternatives for sleep, including melatonin, magnesium supplements, sleep hygiene improvements, and relaxation techniques that do not accumulate in your body dangerously. For anxiety, cognitive behavioral therapy, meditation, gentle exercise, and certain antidepressants are far safer options for people over 70 than benzodiazepines ever will be. Major medical organizations worldwide now recommend avoiding benzodiazepines completely in adults over 65, unless absolutely no other option exists for the situation. The risk of hip fracture alone is so high that many experts consider these drugs more dangerous than the anxiety or insomnia they treat. If your doctor prescribed these medications years ago, it is time for an urgent review, because what was appropriate then is dangerous now. Many people have successfully transitioned off these medications and report feeling mentally sharper, more steady on their feet, and more like themselves than in years. Do not accept that confusion or unsteadiness is just old age when it could be a reversible side effect of accumulated medication in your system. Medication number 2. First-generation antihistamines for allergies and sleep, including diphenhydramine, doxylamine, chlorpheniramine, and similar compounds found in many over-the-counter products worldwide. These medications are found in allergy pills, cold remedies, and sleep aids that millions of people buy without prescription at any pharmacy or store. What most people do not know is that these antihistamines cross into your brain and block important chemical signals needed for memory and clear thinking. After 70, these drugs stay in your system much longer and build up to levels that cause severe drowsiness, dry mouth, constipation, and confusion. Large studies involving thousands of older adults have shown that regular use of these antihistamines increases the risk of developing actual dementia over time. The medications interfere with acetylcholine, a crucial brain chemical that you need for memory formation, learning, and maintaining mental sharpness as you age naturally. Many people take these pills every night for sleep without realizing they are putting themselves at risk for falls, car accidents, and permanent brain damage. The next morning grogginess that people experience is actually the drug still circulating in their bloodstream, affecting coordination and judgment for hours and hours. Respected medical research has proven that older adults using these antihistamines regularly score worse on memory tests and have higher rates of cognitive decline overall. The danger is multiplied if you take these medications along with other drugs that also affect your brain, creating a toxic combination in your system. For allergies, newer antihistamines like cetirizine, loratadine, or fexofenadine are much safer because they do not cross into your brain as easily or accumulate. For sleep, these older antihistamines should be avoided completely in favor of proper sleep habits, melatonin, magnesium, or other alternatives that do not damage memory. Check all your over-the-counter medications carefully because these dangerous antihistamines hide in cold medicines, pain relievers, and sleep aids that seem harmless on the surface. Many people are shocked to discover they have been taking these risky substances for years without any doctor ever warning them about the dangers. The confusion and memory problems these drugs cause can be mistaken for normal aging, when in reality, your brain could function much better without them. If you have been using these medications regularly, talk to your doctor about safer alternatives that will not put your independence and mental clarity at risk. Major health organizations now specifically warn against using first-generation antihistamines in anyone over 65, because the risks far outweigh any possible benefits for allergies. The good news is that switching to safer alternatives is usually simple and inexpensive, with newer antihistamines available at similar prices without the brain risks. Your mental sharpness and your ability to live independently are too precious to sacrifice for a medication that has much safer replacements available right now. Do not wait until after a fall or a serious episode of confusion to make this change. Protect your brain and your independence starting today. Medication number 3. Muscle relaxants, including cyclobenzaprine, carisoprodol, methocarbamol, and similar drugs prescribed for back pain, neck pain, and muscle spasms throughout the body. These medications are commonly prescribed after injuries, for chronic back problems, or for muscle tension that many people experience as they get older naturally. The problem is that muscle relaxants work by sedating your entire nervous system, not just the painful area, affecting your brain and coordination significantly. After 70, these drugs accumulate in your body and cause extreme drowsiness, dizziness, confusion, and a very high risk of dangerous falls and injuries. Medical research has shown that muscle relaxants provide very little actual benefit for pain relief, but cause enormous harm in older adults who take them. The medication makes your reaction time slower, your thinking foggy, and your balance unstable, creating a perfect storm for falls that break bones and hips. Many people end up in the hospital with serious injuries directly caused by falls that happened because muscle relaxants made them dizzy and unsteady on their feet. Studies from leading hospitals show that older adults taking muscle relaxants have emergency room visits for falls at rates 4 times higher than those not taking them. The irony is that the medication prescribed to help with pain often causes injuries far worse than the original problem that brought you to the doctor. There are much better and safer ways to manage muscle pain and spasms, including physical therapy, gentle stretching, heat or ice application, and targeted exercises. Anti-inflammatory medications used carefully for short periods, along with physical treatments, provide better pain relief without the dangerous brain effects of muscle relaxants at all. If you have chronic muscle pain or spasms, working with a physical therapist can address the root cause instead of just sedating your nervous system dangerously. Many people find that regular gentle movement, proper posture, strengthening exercises, and stretching provide better long-term relief than any medication ever could for muscle problems. Massage therapy, acupuncture, and other hands-on treatments can also help significantly, without any of the fall risks or confusion that muscle relaxants cause in your body. If your doctor suggests a muscle relaxant, ask about these safer alternatives first, and explain your concerns about falls and mental side effects clearly. The few days of slight pain relief these medications might provide are simply not worth the risk of a broken hip that could end your independence. Major medical guidelines now recommend against using muscle relaxants in anyone over 65 because safer and more effective treatments exist for muscle pain always. If you are currently taking a muscle relaxant, talk to your doctor about stopping it and trying physical therapy or other safe approaches instead immediately. Your ability to walk safely, think clearly, and maintain your independence matters far more than any minor benefit these dangerous medications might provide for pain. Protect yourself by choosing treatments that address the cause of pain without putting your brain and your balance at serious risk every single day. Medication number 4, non-steroidal anti-inflammatory drugs or NSAIDs, including ibuprofen, naproxen, diclofenac, and similar medications taken for pain, arthritis, and inflammation by millions daily. These are among the most commonly used medications in the world, available over the counter, and prescribed by doctors for all types of pain management. While these drugs can be helpful for short-term pain relief, using them regularly after 70 puts your kidneys and your digestive system at serious risk. Your kidneys are already working at reduced capacity after 70, and NSAIDs further damage the delicate filtering units inside them with every single dose you take. Research from kidney specialists shows that regular NSAID use is one of the leading causes of kidney failure in older adults, often developing silently without symptoms. By the time you notice symptoms like swelling, fatigue, or changes in urination, significant permanent damage to your kidneys may have already occurred irreversibly. These medications also dramatically increase your risk of stomach ulcers, dangerous bleeding in your digestive tract, and life-threatening hemorrhages that require emergency hospitalization immediately. Older adults taking NSAIDs regularly have triple the risk of serious bleeding in their stomach or intestines compared to those who avoid these medications completely. The bleeding can happen suddenly without warning, causing you to vomit blood or pass black tarry stools, requiring emergency blood transfusions to save your life. NSAIDs also raise blood pressure and increase the risk of heart attacks and strokes, especially dangerous if you already have heart disease or high blood pressure. Many people take these pills daily for arthritis pain without realizing they are slowly destroying their kidneys and putting their digestive system at constant risk. If you need pain relief, acetaminophen or paracetamol is usually safer for your kidneys and stomach when used at proper doses and not exceeding the daily limit. For arthritis and chronic pain, physical therapy, weight management, gentle exercise, heat therapy, and topical pain creams work well without the internal organ damage risks. If you must use NSAIDs occasionally, use the lowest effective dose for the shortest possible time, and never take them daily for weeks or months on end. Always take NSAIDs with food to protect your stomach, and never combine them with alcohol, which multiplies the risk of bleeding and kidney damage significantly. Talk to your doctor about checking your kidney function regularly, with simple blood tests, if you have been taking NSAIDs frequently over the past months. Many people are shocked to discover their kidney function has declined dramatically from medications they thought were harmless because they bought them without a prescription easily. Protecting your kidneys is absolutely critical for your overall health and longevity, because once kidney damage occurs, it is usually permanent and progressive over time. The pain relief these medications provide is simply not worth destroying your kidneys or risking a life-threatening bleed in your digestive system at this stage. Choose safer pain management strategies that preserve your kidney function and keep your digestive system healthy for the years ahead of you still to come. Medication number 5, proton pump inhibitors or PPIs, including omeprazole, esomeprazole, lansoprazole, and similar drugs used for heartburn, acid reflux, and stomach protection long-term. These medications are prescribed by millions of doctors worldwide and used by countless people who buy them over the counter for digestive comfort every single day. PPIs work by shutting down the acid-producing pumps in your stomach, dramatically reducing the acid your body makes for digestion and protection against harmful bacteria. While these drugs can be helpful for short-term use during acute problems, taking them for months or years causes serious and often irreversible health consequences. Your stomach acid is not just for digestion, it is also essential for absorbing vitamin B12, calcium, magnesium, and iron from the food you eat daily. When you block acid production for extended periods, you cannot absorb these vital nutrients properly, leading to dangerous deficiencies that damage your nerves and bones silently. Vitamin B12 deficiency causes permanent nerve damage, severe fatigue, memory problems, depression, and difficulty walking that can be mistaken for aging or other diseases wrongly. Calcium and magnesium deficiencies from long-term PPI use dramatically increase your risk of bone fractures, especially dangerous hip fractures that can end your independence forever. Major studies involving hundreds of thousands of people have shown that long-term PPI users have significantly higher rates of fractures, kidney disease, and even dementia. These medications also increase your risk of dangerous intestinal infections, including a severe diarrhea-causing bacteria that can be life-threatening and difficult to treat effectively. Without enough stomach acid, harmful bacteria that would normally be killed can survive and multiply in your digestive system, causing serious infections and complications. Research has also linked long-term PPI use to increased risk of heart disease, stroke, and early death from all causes in large population studies worldwide. Many people have been taking these medications for 5, 10, or even 20 years without anyone ever questioning whether they still need them anymore. The original problem that led to the prescription often resolved years ago, but the medication continued by habit without any medical reassessment of necessity. If you have been taking PPIs for more than 8 weeks, talk to your doctor about slowly tapering off under supervision to avoid rebound acid production. Lifestyle changes, including elevating the head of your bed, avoiding large meals before bedtime, losing excess weight, and eliminating trigger foods work remarkably well for reflux. Antacids that neutralize acid without shutting down production completely are safer for occasional use when you truly need relief from heartburn or indigestion symptoms. Many people find that addressing the root causes of reflux through diet and lifestyle eliminates the need for daily medication that was damaging their health. If you need stomach protection because you take other medications, discuss with your doctor whether you truly need the PPI or if safer alternatives exist. Your bone strength, your nerve health, and your overall longevity are too important to sacrifice for a medication that you may not even need anymore. The most important action you can take today is to schedule an appointment with your doctor specifically to review every single medication you are currently taking. Bring all your pill bottles, including prescriptions, over-the-counter medications and supplements, and ask your doctor to evaluate each one for safety after 70 years. For each medication, ask these specific questions. Is this still necessary? Are there safer alternatives available? What is the lowest effective dose I can take safely? Do not stop any medication suddenly on your own, especially benzodiazepines or PPIs, as this can cause dangerous withdrawal symptoms requiring gradual tapering under medical supervision always. If you have kidney disease, heart failure, liver problems, or take multiple medications daily, these warnings are even more critical for your safety and health. Some people may need to continue certain medications despite the risks because their specific medical situation requires it, but this decision must be made carefully. Thank you so much for watching and taking the time to learn about these important medication risks that could be affecting you or someone you love dearly. If you found this information valuable, please like this video, share it with family and friends who need to know this, and leave a comment with your thoughts. If you found this information valuable, please like this video, share it with family and friends who need to know this, and leave a comment with your thoughts.